Live. We're talking with Dr. Tim Jacobson from Kaiser Permanente Northwest. You are the Chief Cardiology at Kaiser, and we're going to talk about heart health. We're continuing this conversation, and about exercise, which I think really the two go hand in hand. So welcome. Thanks for being here.
Thank you.
So I want to start off with exercise in general, right? So if we are exercising regularly, and then if we're not exercising regularly, talk to me about what that does to our hearts, because I'm one of those people.
Yeah. So I think probably best to take a tiny step back first.
Okay.
And I think the way I look at exercise is to ask myself, how much do you need to do to start with?
Okay.
And then how do you protect yourself against bad events during exercise?
Okay.
And at what point have you done so much that you might hurt yourself? And I think that those are pretty excellent, good spots to start. So if you look at Americans, about 1 in 8 of us will die from basically a sedentary type lifestyle,
right.
Issues related to being sedentary.
Okay.
Only about 20% of women and 25% of men are getting the recommended amount of exercise.
20% and 25%.
20 and 25%.
Oh, we can do better than that.
Yes, we can.
Yeah.
And about 1/4 of our population is completely sedentary.
Wow. Okay.
And so if you look at the risks of that kind of lifestyle, that far outweighs any potential risk of exercise, whether you're doing it intermittently, all at once, you start and you stop.
Okay.
So the risk of being inactive is so much greater than the risk of doing anything exercise-wise that anything you do is of benefit to you.
Okay. I mean, so I think that's a really good way to answer that question, because a lot of us get so stuck in, and we can talk about this too, right? Having goals and what the appropriate amount of exercise is for you. But I think that to maybe give ourselves a little bit of a break and say, hey, listen, if you're not exercising all the time, your whole life on a regular basis, but it's nice to know that it's as long as you're doing something, if you're getting up and moving, and maybe it's not every day, but every other day or a few times a week, to not punish ourselves about it, because I do that sometimes. Yeah. Okay.
Yeah. So I think the way I kind of look at your question is, let's say hypothetically you're a weekend warrior.
Sure.
And you're the kind of person that's just going to go out and do your exercise on the weekends, and that's all you're going to do.
Right.
Well, there are studies that actually show that that is still a benefit to you.
Okay.
That you won't hurt yourself by doing that, and that you will get an incremental benefit from doing it.
Okay. It's really, because a lot of us live really busy lives during the week with work and kids and sports and you name it, whatever. So I don't know that I'm a weekend warrior in that sense, but but that's good to know. And then so let's talk about then recommended amounts of exercise. So if you are generally healthy, or if you are trying to get back into an exercise routine, what do you say to those patients? Yeah,
so the goal, the recommendations currently are to be active for 30 to 60 minutes, 6 days a week.
Okay.
And I would say that that recommendation is moderate exercise. Moderate exercise is kind of walking to the point where you're a little bit short of breath, but you're really not suffering, and you can still carry on with a conversational. A conversation with somebody. It's interesting that you get about 50 or so % of the benefit of exercise when you go from doing nothing to something. And so all you have to do is go from being really a relatively sedentary person to moving an average of 15 minutes a day.
Okay.
And you'll get about half the benefit of being physically active, or you'll reduce your risk of death by 50%. So
that is pretty crazy.
Yeah, and that's what I try and emphasize with my patients, because I think a lot of us focus on, I'm not doing it well enough. And so we kind of feel defeated and we stop.
Sure.
And I think it's really important that we all know that even turning 1 hour of your week from being in a chair to doing housework or to doing yard work has been shown to be beneficial.
Wow.
There have been studies looking at twins where one of the twins is walking an average of 6 days a month for 30 to 60 minutes, and the other is inactive, and the twin that's doing those 6 walks a month has half the risk of dying of the other.
Half the risk.
Half the risk.
I mean, that's incredible.
It is incredible.
Yeah, that's incredible. Okay.
It is incredible. And so I think that, really the data is very clear that going from nothing to something, you do reduce your risk, by 20, 50%, depending on what study you look at.
Right, sure.
Now, you can get a little bit more than that if you decide to go further and do more. So there have been studies looking at men in their late 60s, early 70s. Those who walked more than 2 miles a day got a little extra benefit from that.
Right.
There have been studies looking at people who add a few runs a week. So people who are walking most days of the week, but then they run for maybe 20 minutes a few times during the week. And those people seem to live about 4 years longer than other people. So what I usually focus on when I'm talking to a patient about what they should be doing in terms of exercise is do something. I don't care what it is.
Yeah, right.
You just have to like it and stick with it.
Right.
And that you're getting the majority of the benefit by doing that. But then if you really want to maximize your benefit and reduce your risk by 80% risk reduction, then you probably have to get to the point where you're running a little bit every now and then.
Right, okay. I do that. Sometimes I hear a good song in my iPod, and I'm like, I'll start running, and then I'm like, wait, Haley, you're running. What are you doing? Like, because I'm not a runner.
Yeah.
But sometimes it feels really good, and I won't go for long, maybe, 3 or 4 or 5 minutes. But it's good to actually really just go.
Yeah.
It feels good.
Yeah.
But can you exercise too hard? Like, to the point where it actually is not beneficial to your heart? We'll talk about that too.
Yeah, that's an excellent question. So there have been some studies that have said that you can cause atrial fibrillation by exercising too much, or you can harden your arteries by CT scan measurements.
Okay, what is that? Okay, so I'm gonna just let you go
Yeah, but that data hasn't been borne out in every trial.
Okay.
And so I think the biggest and most recent publication that kind of addresses this is the one I mentioned, came out of the Cleveland Clinic, where they looked at 122,000 people that underwent stress testing at their institutions, from 91 to the late 2000s. And they followed them for an average of 8 years. And they just looked at, okay, so where did people fall in terms of the fitness level?
Okay.
And then who did the best and who did the worst and who was at the highest risk of dying. And they collected information on what other illnesses every one of these people had.
Sure. Because that plays a part.
Yeah. So I think a lot of people will ask, well, I have a cardiac disease. And I think the natural reaction is to say, I have heart disease, I should do less. Or very well-meaning family members will go to a patient and say, you've got this cardiac diagnosis, I'm going to mow the lawn for you now.
Right.
Grandma shouldn't be out in the grocery store anymore. We should be doing the grocery shopping for them. That kind of a thing. And I hear a lot of that in my office. But it turns out that's exactly the wrong thing to do.
Right.
And so that if you look at the very fittest people, they had 20% of the risk of dying of the least fit people in this 122,000 patient database. It's a huge database.
Yeah, it is, yeah.
And what they were able to show is that the fittest 2% had the lowest risk of anybody. And so generally those are people who are capable of running, at any given age.
Right.
And so I think that really provides us a lot of reassurance in the sense that you can be as fit as you want. Okay. And in the studies that really show us how fit you are with objective measures, meaning you were on a treadmill. Everyone went on a treadmill for this study.
Right.
That there probably is not an upper limit. Although some people have suggested there might be.
Okay. So it doesn't really increase your risk of heart attack or having, kind of negative impact to your heart health if you're exercising, intensely or aggressively.
Yeah. So there are two answers to that, and the first answer is yes. There's a known risk of cardiac arrest or having a heart attack with exercise.
Okay.
In men.
Okay.
It's 1 in 1.5 million hours, or 1 in 1.5 million hours of exercise.
Okay.
In women, it's 1 in 36 million hours of exercise.
Okay.
And in collegiate athletes, the risk of cardiac arrest is about 1 in 50 or 1 in 100,000, and that's the same as for marathon running.
Okay, interesting.
But if you look at
how you break it down like
that.
Thank you.
Yeah. But if you look at your risk of dying in any given year, it's way higher than that. And when I tell you that the fittest people have 20% risk of dying compared to everybody else, those people are obviously exercising all the time. So that tiny risk is already folded in there, and it's still they're 80% less likely to die.
I hear what you're saying, Dr. Jacobson. You're saying basically you could die walking outside of a building. Like don't stop exercising because of that. Like you got to keep going.
Yeah.
It's good.
Yeah.
Good statistics, by the way. All right. Well, so then let's talk about heart strain during exercise, though. Oh, we have some questions. Sorry. I'm so engrossed in what we're talking about.
Well, that's great. Yeah,
but thanks for joining us, and you have a question.
So are the viewers. So they have questions. Colleen would like to know, what are your tips if you work a 9-to-5 desk job?
Yeah, Colleen, I would say that getting up and moving as much as you can is the right thing to do. There are some people who argue that being sedentary actually, confers a lot of risk. Some people will say do some standing at the desk, and I think that's reasonable. I think trying to get up and move as much as you can during the day. But then what I would argue is that you really need to focus on adding activity during the other hours of your day. I'm not going to tell you that that's easy.
Right.
I'm going to tell you that you're going to have to be creative. Most people who are working those kinds of jobs are also taking care of families, and the question is where you're going to fit it in.
Yeah.
And often what I say is, having a gym membership and thinking you're going to bring a gym bag and then make it to the gym for 2 hours after work and then get home and participate in all the family activities. I personally, as someone who's kind of in that part of life, I don't find that to be realistic. So what I try and do is incorporate exercise into other parts of the day. Can I make it part of how I get to work? Or can I take part of my lunch and go do something?
Yeah.
Or can I park a little further away from every spot I have to be at and add? And all of those little things add up and add benefit. So I think that would be the way I would approach
Being
that.
creative, I think, is the best thing that you said there, because this kind of goes in with how do we fit it in, and punishing ourselves because we haven't done it by the end of the week. But if we just maybe think outside the box, you can get your 20 minutes of walking a day or whatever it is. Yeah. Okay.
And I think that's really key. I think the message is don't beat yourself up and decide that you shouldn't do it because you're not achieving marathon status.
Right, yeah.
Right? That's not what you have to do.
Right.
You just have to do something.
Yeah, just got to get up. Any other questions?
Yeah, we have 2 more questions.
Okay. See, I told you this was fun.
I'm sorry. We have 3 more questions.
Okay.
So Becky would like to know, how do you feel about the keto diet specifically for someone with heart issues?
We're going to get to the diet stuff in a little
so
bit.
hold off on that one.
Hang tight on that. We are going to talk about heart healthy diets and things like that. So let's kind of do the more exercise stuff first.
Okay, and then Lucy asked, so if we work out, that can lower heart disease or the risk of heart disease?
Yes, so you can reduce your risk of having a heart attack 30 or 40% with exercise alone.
30, that's almost half.
Yeah, and if you don't smoke, you keep your blood pressure low, you keep your body weight down, you exercise, you can reduce your risk by up to 80%.
Wow. Okay.
By taking care of yourself.
Yeah, those are some good numbers.
And one more question. Yes. Lisa wants to know, she says, my heart rate has been as high as 220 resting. Should I be concerned and keep exercising?
I think if you have a heart rate of 220 at resting, you should go and see a doctor about that. That's a very, very high heart rate at rest. Yeah.
Yeah. Okay. Good advice. So then, that's kind of where we. Anything else about exercise and heart health and kind of? I mean, I think you really kind of nailed it with everything you said. But the next question is about sudden death syndrome. So I want to talk about if that's something that that we should be concerned about, and are there signs that we need to look for, and are there certain risk factors, right, age or demographic that affects more than others?
Yeah, so there's always a tiny risk of sudden death when you're exercising.
Okay.
That'll never go away. It turns out that in the adult population, the way to protect yourself against dying during exercise is to be a regular exerciser.
Okay.
So there are some studies that suggest that heart attack risk is about double what it is other times during or after exercise if you're not an exerciser.
Okay.
But that risk is really reduced if you regularly exercise, and the benefit of regular exercise adds up.
Okay. May I ask a question? Sorry, just to interject, but so I don't know if I'm a regular exerciser or not. So maybe let's talk about that. Like, I'll go for 2 or 3 times a week, a 4-mile walk, run. Sometimes I jog, and then maybe the next week I don't fit in that loop, right? That I do. And then the next week I might do it another couple times. So am I a regular exerciser or am I not?
I would say that you are. However, I think that the risk of have something bad happening to you during exercise is so low.
Okay.
It's 1 in 36 million hours.
Okay.
And so you'd really have to be out there a lot. So again, yes, I think that there is always a big tiny risk.
Know, this is what I do. Am I regular or not? And so
yes.
So
and I have a pretty standard answer to that when I'm visiting with patients, and I say, look, we're all going to die.
Right.
Some of us are going to die when we're exercising.
Okay.
The way not to die during exercise is to exercise as much as you can and try and make it regular.
Okay.
But the benefits of exercise, even though there's a tiny risk, are so great that shouldn't stop you from doing stuff.
Okay, good. All right. So, sorry. Continue to what you were saying.
No, I think that's
No, just about regular exercise and how that makes a difference with sudden death syndrome.
Oh, yeah. So there are some people. So there are people who are at risk for sudden death during exercise.
Okay.
There are certain cardiac conditions that will increase your risk.
Okay.
Things like hypertrophic cardiomyopathy, arrhythmogenic right ventricular dysplasia, having a coronary artery from a funny place, things like that.
Things that your doctor has already talked to you about.
Yeah, and so hopefully those things have been identified. They're not always identified, so there are still tiny risks in people, especially young people. And then if you look at the causes of bad heart events during exercise as we get older, it tends to be hardening of the arteries.
Okay.
And so there is always that tiny risk. We can't pick up all of that stuff, but at the same time, I wouldn't say don't do something because you're worried about that.
Got it. Okay. Okay, no, I think that's good. I think that's sort of the general lesson here is not to be afraid of the risks, but still get out there and move. Yeah.
But that being said, I would say that if you are very concerned or if you have symptoms that worry you before you exercise, go get checked out.
Right, okay. So I did ask about signs, symptoms, signs that that might indicate that you are having a heart event or something. Like what would people look for or feel that would cause them to, okay, I need to call my doc?
I would be concerned if people started doing exercise and they were getting chest heaviness or pressure or upper abdominal pressure.
Okay.
That would always go away with exercise. Or if you're walking with your partner in the mall and that person seems to be completely unaffected by what you're doing and you are just panting and sweating and it's a new change for you especially. So you may feel something like that when you start if you're really out of shape, but as you're moving into things and that starts coming on you, or you start getting lightheadedness or feel like you're going to faint with exercise. Those are the kinds of things I'd say better see someone for those.
Okay, good to know. And then let's talk about different types of exercise. We've talked a lot about just kind of getting up and moving and walking, obviously jogging, that's really good. Are there what about strength training or lifting weight, like that kind of exercise also? I mean, aerobic I know is great, but are there other exercises that also help benefit our heart?
Yeah, well, I think I think those other kinds of things really benefit the rest of us.
Okay.
So I think weightlifting is really important as we get older because we tend to lose muscle.
Right.
And so to maintain strength and to feel like we can do what we need to do during the day, making sure that we add a little bit of that in is important. I think maintaining flexibility and yoga type activities can help prevent injuries over time. So I think there is value in that.
All beneficial, but aerobic is what we need for our heart health.
I would argue that, yeah.
Okay. We have another question.
Two questions. Lisa would like to know if it's more risky to exercise early than late.
In the day
or by age.
Okay.
That was her question.
Yeah, I'm not aware of a big study that says, early in the day is worse than late in the day. And I think the reality is I try and make it as easy for people as I can. And I just say, when you have time, do it.
Right.
So whenever it is, I think that's when you need to go for it.
Yeah, okay, good.
And then David would like to know, he says he swims 300 meters a week. Is that enough for a 69-year-old? He says he has had 6 stents. 6 stents,
yeah. So it's very interesting. That study I talked to you about the Cleveland Clinic with 122,000 patients, they actually looked at people specifically who have coronary disease. And the question was, if these people are exercising to the point of great fitness, are they at risk? And it turns out that the more fit the people with coronary disease were, the longer they lived and the better they did.
Right.
So I would say that, swim as much as you feel like you can.
Yeah, right. It kind of goes back to, I think, what you're saying, like grandma's heart is, maybe more fragile than it was, so let's mow the lawn for her. No, it's kind of, you can still exercise if you have heart issues.
Yes.
And that actually was sort of my next question. Do you recommend that people that maybe have heart problems, like, is it safe for them to exercise? Well, yes, it is, but what would you say? What types of exercise would be best?
Yeah, so what I would say is make sure that you've had an evaluation, right? So that you've been interfacing with the medical system, your doctors, and they say, hey, that you're ready for it. And then what I tell my patients is so some people really benefit from a program called cardiac rehab. So if you've recently had a heart attack, a stent, bypass surgery, valve replacement, open heart surgery, things like this, then you can do a cardiac rehab program where you're in a structured setting 3 days a week for 12 weeks.
And get some support there too.
Yes, so there are support groups generally with those kinds of programs. That's great. If you look at most patients, at least our patients, only 15% will ever complete that program. And so we're moving into a virtual space where we're going to try and provide people virtual resources to make sure that they're doing that kind of stuff. Great. So that kind of technology does exist. Sure. But I think that making sure that everyone on your care team agrees it's the right time is the right thing to do. And then I tell people to ease into it. Because what you often see, or at times you see, is someone says, you know what, I'm ready, I'm doing my half hour, and they go out and walk 2.5 miles, and they haven't done anything for a while, and they feel terrible for 2 or 3 days.
Yeah.
And then they come back and say, hey, I can't do this. Exercise makes me feel terrible.
Right.
And I say, I'm sorry, what I didn't tell you to start at 5 minutes, not 30 minutes.
Right.
And to gradually work up so that you do tolerate it better.
Yeah. We'll get some more questions. Yeah.
Yeah, so a follow-up, I don't know if I asked the question incorrectly. David, he put in a comment that said 3,000. So if I said 300 or something, I apologize. But he says he swims 3,000 meters a week, and he wants to know if that's enough for a 69-year-old.
Yeah, I think that sounds like a great.
Yeah.
That's pretty impressive.
I was David, I think
David's
that's
winning.
Amazing. Yeah, David's
winning. Doing the right stuff.
It's way more than I swim.
Yeah, no, I couldn't. Yeah.
That's incredible.
Yeah.
And swimming really is.
I'm sorry, we have a question from Barbara as well. She wants to know if high-intensity interval training is recommended over normal aerobic for for heart strengthening?
So you will probably get a small benefit from adding that. So, when I talked about how people who added a little bit of running were getting a little bit of additional benefit, yeah, I would think that I would anticipate that you would get a little increment of benefit in that.
Right. Well, because the heart is a muscle. And so, you just kind of give it a little push, you're working it out.
Yeah.
Right?
And I think for people who are really trying to achieve, if you've got a goal, you want to run a race a little faster, or if you want to ride a bike a little faster, that high intensity interval training really gives you that extra boost, I think, in fitness.
Yeah, okay.
So there's value in it, for sure.
Good. Any other questions for right now?
Not right now.
Okay. So let's move on. This is about atrial fibrillation. So how do you recommend people with atrial fibrillation, how do they approach exercise regimens?
Yeah, so that's an excellent question, because we've had more data accumulate that says that people who have atrial fibrillation that comes and goes can reduce the amount of atrial fibrillation they have by becoming more fit. And probably
interesting.
It is, and I think that I see a lot of people referred to me where they've been told by people, hey, you got atrial fibrillation. Don't do anything until you see the cardiologist.
Right.
And what I spend a lot of time with is, hey, actually, if you do a little more and you're a little more fit, your risk of having the AFib come back and be annoying for you is going to drop a little bit. So I really encourage people to be active with AFib. Now, I think it's important that people have already addressed, meaning that address the heart rate and their stroke risk and the things that need to be managed in a medical setting.
Right.
But once that's done, exercise is of benefit in those people too.
Right, something that you would prescribe.
Yes.
Yeah, okay, good to
know. Yes.
All right, let's talk about fitness trackers. Everybody seems to have a fitness tracker, whether it's Fitbit or Apple Watch or whatever, and they all monitor this and that, and they beep at you and whatever. I finally just stopped wearing mine because I was like, enough. So let's talk about fitness trackers, but where we can get benefit, what we really should be paying attention to with that information that we're getting.
Yeah. There was a study that came out not that long ago that said that people who tend to focus on those a lot tend to stop a little earlier in their exercise than others, right? Because they've achieved a goal.
Yes.
And that people
couldn't get to it.
Okay, I think probably both, right? So I don't tell people to focus on that.
Okay.
I will sometimes ask people though. So people have physically active jobs, and people will describe different jobs as physically active. I've had people come to my office and say, "Yes, I'm physically active. I stand at a cash register all day." And I say, okay, well, I know what you're doing day to day. You're not that active, right? If that's activity to you. And then I have other people say, I'm active, I'm in a factory and I'm moving all the time. And then I'll ask them at times, do you have a phone that tells you how many steps you're doing? Just because I'm trying to get a frame of reference for how much that person's moving. And it's not uncommon that those kinds of people are moving, walking 10, 15,000 steps a day.
Yeah.
It really helps me understand, okay, well, you know what, you don't need to be spending another half an hour in a gym a day.
Okay.
You're already doing plenty. So I find them to be of value in that context.
So it is a good way then to gauge, maybe, so the gal who wrote in earlier about, she's got a desk job 9 to 5, like a lot of people do. But maybe if you have one of those step trackers, you're maybe walking more than you realizing.
Yes.
So another reason not to punish ourselves.
Yes.
Okay. But
yes.
So there is value in this, maybe the step trackers. But what about any? A lot of them have bells and whistles with all the.
They do.
Here's your heart rate, and here's your this, and your whatever. Are those important to be paying attention to?
I don't recommend them per se. Okay. I have some patients who really like to, so I think the Apple Watch has an EKG function.
Right.
And some people who have a lot of issues with palpitations and they're not sure if their heart's in rhythm or out of rhythm, those kinds of things can provide reassurance because they can say, okay, yes you are, or no you're not, and kind of can tell people what their heart is doing in lifetime.
Okay.
But I don't necessarily recommend them to everybody.
Okay, good. And another question, yeah.
Yeah, we have 2 questions. Okay. Lisa C. She said she's had 2 ablations. She feels tired a lot and sweat pours off her when she works out. She wants to know if that's a sign she needs a recheck.
I think that if it's a change from the way you've been in the past, it may be. But in people who are getting back into exercise programs, that's not uncommon for us to hear. And so sometimes we visit with these people and we decide there's more testing required. Sometimes the visit is really oriented more towards us providing reassurance. So I think if people have symptoms they're worried about, it's always the right thing to reach out to your care team. But I think understanding that sometimes what we provide is more reassurance than further testing.
Yeah, that's a good way to answer that. Because I do think that what you're trying to drive home here is if you're noticing a change. If something is different after you're doing the same kinds of things, right, that's when you really want to call your doctor.
Yeah.
And that's good to know. So, yeah. Any other questions? Yeah?
Yes, Vanessa has a question.
Okay.
She says she recently lost function of her right lung due to an elevated right diaphragm. She's gained 56 pounds in the last year and would like to lose it, and she is asking, what do we recommend for that as far as a starting exercise?
Yeah, I would start with something short and easy. So, in somebody who's really getting back into something, who's got underlying lung issues, and that person's going to be short of breath and they're not going to tolerate a lot initially. Mm-hmm. It turns out actually exercise benefits the lungs too, and there are programs for pulmonary rehab and things like that, so that's all been shown to be of benefit. So what I would say is ease into it. Start with something that you like. It doesn't have to be anything difficult, and even if it's just walking around the block 2 or 3 times or one time, just at the start, that would be the right way to start. Yeah. But I think you have to give yourself permission to initially move slow and to not go that far, and that's just fine. And you should be congratulated for being interested in starting.
Right. I mean, that's really the main thing here, right? Is that she wants to start. Yeah. I think that's great.
Yeah.
Okay, so then let's talk about other good measurements of success when we're determining how healthy our heart is, right? How else can we measure that?
Well, I think, you can follow your blood pressure.
Okay.
You can follow your resting pulse. Mm-hmm. So it turns out that a low resting pulse is a healthy sign. Okay. So sometimes we get people referred to as someone who's very athletic and young, and they have a heart rate at rest in the 40s. Mm-hmm. And we get, this person's heart rate is too slow. Well, it turns out that mammals only get so many heartbeats in a lifetime. Mm-hmm. And you can predict the lifespan of any mammal by knowing its resting heart rate.
Really?
So mammals get about 1 billion heartbeats per lifetime. Huh. And so one of the things that exercise does is it increases what we call vagal tone, which is the relaxation nerve to the heart gets more active.
Okay.
And so your resting heart rate will fall. And so you're not using the heartbeats you get in your life as quickly. And so that's maybe part of the reason that people who exercise a lot seem to live longer. I think, seeing that your heart rate is slower is also something that's a benefit. And then, of course, looking at your cholesterol and things like that. Yeah. And then keeping an eye on your weight and making sure that your weight isn't increasing.
So knowing your numbers. I feel like we talked about this before. No, not you and I personally, but with Kaiser. Know your numbers so that you kind of know where you are and where your healthy range is, right? Yeah. It's really important to just kind of start there.
Yeah, and I think it's important that you know that you have control over a lot of your risk factors. Yeah. So, even in people with the worst genetic profile, those people who paid attention, took care of themselves, had half the risk of the other people who didn't, who had the exact same genetics. So you really have a lot of control. Not complete control, but you do have a lot of power over your own health.
Okay. Next time I go to a trivia night, I'm inviting you because you have this just fountain of knowledge and statistics that are amazing.
Yeah, there you go. Yeah.
I'm going to call you next time.
I'm ready.
Okay.
As long as it's about cardiology.
No way. Yes. Well, you can answer
Nothing else.
Answer all the cardiology questions. Anything having to do with the heart.
Right,
okay. Right. So I want to talk about exercise then, so I'm kind of entering that middle-age part. But what about when you're young? My kids, I honestly don't think they ever sit, but so kids are really active. But let's talk about exercising when you're young and if that is beneficial to you later on in life and kind of just having a lifetime. To me, that would make sense, right? Being healthy your whole life is good. But let's talk a little bit about how that can help your heart when you're older.
Yeah. So I think that, when we're young, we basically set up the pattern for the rest of our life.
Sure.
So I think if a teenager decides that they're going to spend their time playing video games and not moving and become a more sedentary, heavier person, that predicts a much different life than the person who's a little bit more in the sports or not even in an organized sport, but is trying to stay active, rides their bike, gets outside, goes on hikes with the family, whatever it may be. Right. I think it's during those years, in your teen years, in your early 20s, that you really decide how a lot of your life is going to unfold. And as a cardiologist, I start to see the differences in people when they hit their 40s. So, people who made the decisions to be a little bit more sedentary, heavier, not move as much, I'm starting to see them accumulate diseases. Whereas the people who made the decisions to be more active and to be, do the right things, they tend to delay. Yes, and even if you're not, and even if you're like, I can't believe I have to get up at 5:30 again to do this, those people, they're really pushing back the disease much further.
Okay. It doesn't surprise me. This isn't shocking, but it's just good to hear it.
Yeah.
From someone who.
But that being said, I wouldn't say I wouldn't want to give people the message that if you didn't start early, it's not of benefit.
Well, right, or that it's too late
now.
Right.
And basically, my perspective is it's never too late. Even in people who do cardiac rehab, after they've had bypass surgery, there's benefit to starting that exercise program.
Sure. But I think you were just talking more about just an overall general lifestyle, and that you do see differences in choices, right? Yes. Yeah, but it's never too late to start.
Yes.
Question. We have a question from Nancy. She wants to know if the heart recovers itself.
Great question.
So it turns out that you can actually make the heart more efficient with exercise over time. With medications and appropriate treatments for cardiac disease, you can certainly see improvement in heart function in people who have reduced heart function. So the answer to that is yes, in part.
Yeah. Okay. Interesting. And I think her name was Carol who asked the question about diet, but we'll kind of maybe switch to diet now. So Carol, if you're still there, thanks for waiting. Let's talk about diets and heart health. And are there diets that are more beneficial to be on? I know we've talked in the past about Mediterranean diet, which I think is good. But let's talk about other diets that are out there, other phases and fads.
Yeah. So my perspective on this is that the reason there are a million different diets is that something is right for somebody. Well, there are different things.
Different body chemistries.
Yes, exactly.
Sure.
Exactly.
Right. Got it.
I usually recommend to people that they try and avoid processed meats.
Okay.
And refined sugars.
Okay.
And I think if we just do those two things, you're getting the vast majority of the benefit of the diet. So, avoiding the salamis, the hamburgers, the bacons, the hot dogs. I know, I'm there too. And then the sweets, right? So, Portland is a huge donut town, a great donut town. But I think of like the maple bar with the bacon on it. I look at that and I think that's job security for cardiologists.
Yeah.
I mean, that is just a wonderful.
Is it really?
Well, that's the way I think of it.
Okay.
I mean, just,
what about apple fritters?
That's another bit of job security for a cardiologist. Those are great. So I'm not saying you can never have these things, of course.
Once a year.
Yes, that kind of thing is fine. But I think that the people who tend to incorporate that kind of thing in their diet with more regularity are the people that are more likely to end up in my office.
Okay, interesting. So this is sort of a sidebar question. Oh.
Sorry, I just wanted to interject really quick. I went back and looked through the comments. It was Becky who asked the question. So.
All right, Becky. There was a Carol, but okay. Becky.
Probably.
Okay, so then I actually had kind of a side note question to that. My son, he loves his burgers, and he loves his bacon. And he's one of those challenging kids who he just doesn't eat really like an overall, like, okay, my daughter, she's like, Mom, can I have an apple? Can I have some broccoli? Can I have a carrot? I don't know, she's a totally different child. Well, of course she is. But my son is just like, Mom, I want a bagel, or I want a burger, or I want a bagel. Now, he's 7, so I keep thinking, he'll grow out of it. He's really physically fit. Like, he's always moving. He's active. He's in organized sports and also just goes out and shoots hoops and rides his bike and whatever. So, like, do I need to be worried about, I'm a mom, so of course I worry about it. Let's get personal here. Like, what do I need to do? Do I need to, like, force feed him vegetables?
Probably not.
Okay.
Yeah, I think it's too early.
Okay.
I think it's too early to worry.
Okay.
I think that, when he's 15,
sure,
if that's all he's eating, then I would start being a little bit more worried.
Okay.
Because my concern would be that that's going to become a very long-term pattern. But, I have kids that have gone through the exact same kind of thing. Like, I'll only eat, I'm going to eat frozen pizza tonight, and then I'm going to...
Yeah.
And I think that, of course, we've got to feed our kids, right? So
well,
you don't want to starve. But I think that it's probably too early to worry. And I think more important is that he's not then also deciding that he's going to spend all his day in front of an iPad or a video screen or the television.
Right.
And so, making sure he's outside doing the right things, then that will really, I think he'll be okay.
I mean, this is, I think I do this. I tend to do this at least once. I give like an honest, Haley, I have a real question, But there are a lot of parents that are also struggling, I think, with that. So thank you for the honest answer. And another question.
Lisa C. has a specific question about the keto diet. She says she's doing keto, counting macros, and also no sugars. She's down 27 pounds. She wants to know, will this help keep my heart healthy, or is keto bad?
I'm not aware of any data that says that keto is particularly bad. There are some people that suggest that the proteins in that diet should maybe come from vegetables as opposed to all meats. So some vegetable protein is important in that diet.
Sure.
But I think that if you're seeing that you're losing weight, you're feeling better, you're moving in the right direction, your blood sugar control is likely better, then I think those benefits, are far outweigh any potential risk.
Yeah, good. And good for you. Yeah, congratulations. Okay, and so I guess as we wrap up, maybe just talk about overall, like, if we're exercising regularly and trying to start if we have a goal or start a routine, whatever it is that we're doing, as long as we're being active, are there other things that we need to worry about regarding our heart health if we're doing that? So tell me what else you would say. You definitely should not do that. You definitely should do this. Maybe give me a couple of...
Okay. I mean, the easy things, right? Don't smoke.
Yep.
Don't use meth.
Right.
Cocaine, stimulants. There's a lot of that in our community, unfortunately.
Okay.
And I think people don't appreciate how dangerous that is to our heart.
Okay.
There's a little bit more data on the risks of marijuana use, and that may be about the same as tobacco, unfortunately. And I think that is going to be an evolving story.
Sure. Well, now that it's legal here and in other states,
right. So I have a lot of patients that like to use marijuana products, and I tell them not to smoke any of it because I'm worried about that, to be honest. And then, I think you got to try and avoid the sugars and the refined meats and the processed meats or the processed meats in your diet. And then keep an eye on your blood pressure, your cholesterol, and your weight. And again, if you're doing all those things, and the reality is the number of people in our society that are able to do all those things is really small. But even doing parts of that, it adds benefit. So you don't have to be perfect.
Now, can you call your doctor and say, hey, what's my cholesterol? Or what's my blood pressure? Like, can I call my doctor just so that I know kind of where I am right now?
Sure.
Yeah,
sure.
You can do that.
Yeah, I think Kaiser patients can find all their stuff online.
Even easier.
And I think probably other medical systems can do that.
Good. No, I think it's good. Again, kind of knowing where you are at what point, and then kind of keeping your eye on it yourself. Like being accountable for your own numbers is important too. Okay, and so I think you probably already put it up because you always do, but kp.org/cardiac/NW. All right, people have questions or want to learn more. Any other questions, kind of to wrap up our?
Yeah, we have one last question.
Perfect.
I told Martha we'd ask it before we wrap up.
Okay, good.
She said her husband had a quadruple bypass 6 years ago, and she wants to know if it's true that bypasses are only good for about 10 years.
So there's data on that. There are two ways to answer that question. Is there a risk that one of those 4 bypasses will have a problem over those 10 years? Yes, there is. However, the average survival for someone after bypass surgery currently is 15 or 20 years. So I don't give people a 10-year timeline. And I have patients who are 30 or 40 years after bypass surgery who are doing well. And those tend to be the people who've decided to do the right stuff after their event.
Right. To have those healthy lifestyle choices. Yeah, good. Okay, any other last, trivia? Like
any more stats I can spout?
Stats or
No, I think I give as many as I can. But again, what I would say, and I think it's important to give yourself permission to start slow. You don't have to be perfect, and something is way better than nothing. And those are the things that I would say.
That's perfect. I kind of wanted you to end on that. So thank you. Dr. Jacobson, thank you so much.
Of course.
Kaiser Permanente, Chief Cardiologist there. Really appreciate it. It was informative and also fun. So
thank you
very
for
much.
having me. Really
and thanks, everybody, for joining us today. We'll see you next time.
Thank you.
Bye. Yeah, that was great.
Good.